Hi, everyone. My name is Emily, and today I'll be talking to you about a research project about the long-term effects of cancer treatment on pediatric cancer survivors' quality of life. This is a mixed method study. A little bit about myself. I studied nutritional sciences and cell biology at the University of Connecticut, and then went on to nursing school at MGH Institute of Health Professionals in Boston. From there, I worked as a pediatric nurse in the float pool, both at Yale New Haven Hospital as well as Boston Children's Hospital, in which I cared for children of all diagnoses, including cancer. I'm now currently still working as a pediatric float pool nurse, and I am working on getting my master's in nursing at Regis College and hope to practice as a family nurse practitioner in the future. Some background for this project. So over the last decade, there have been many advancements in cancer treatments, leading to the improvement of survival rates for children worldwide. Recent studies have shown that 80% of kids with cancer are expected to become long-term survivors. However, these therapies used to treat cancer can affect essentially every part of the body, including organs, tissues, growth, development, neurocognitive development, leading to memory and social adjustment issues. Pretty much just any part of the body can be affected. Although some of these effects may be short-term, there's not enough evidence on the long-term effects of these drugs and treatments to determine how they are affecting the lives of these survivors. Typically, adult survivors don't always notice these long-term effects because their lifespan post-cancer is shorter than a child's. However, when a child has a whole life to live, many problems arise and change their well-being and quality of life. The purpose of this project is to assess the perceived quality of life of these pediatric cancer survivors so that treatment can further be developed and improved to reduce long-term side effects. Additionally, the study can allow researchers to determine exactly what is having the greatest effect on these children's quality of life so that physicians can aim to find solutions to help improve this and solve these problems. There are many gaps in the research after doing an extensive literature review on this topic. First, there's a lack of information about the specific long-term effects of various cancer treatments, since some of these are so new and there has not been enough time that they have been used for, and not enough data collected to confirm how these drugs actually are affecting these bodies of these cancer survivors. Additionally, there are gaps in relation to the differences between male and female pediatric cancer survivors and how treatment affects each gender differently. Next, there is little known about the psychological effects on childhood cancer survivors and how and why treatment causes these effects. Lastly, one of the big gaps that was found was that there is a lack of information on how the age of diagnosis of cancer and the length of the cancer treatment affects these kids' quality of life. This is going to be a mixed method study, and that just means that there will be multiple methods used. Initially, there will be an electronic survey that follows the PEDS quality of life tool that is very widely known and used, that will be sent out to participants once informed consents are signed and whatnot by these people in the sample. The surveys will continue to be sent out to more and more participants until the data is saturated. Once this is achieved, these participants will then be asked to do an in-person interview to determine more specific details about what affects their quality of life. If they are too young to answer the survey and the interview questions, a parent will be allowed to answer for them. The interview will be fairly short and in person. It will just consist of 10 open-ended questions. And the sample method will be purposive. We will ask the doctors taking care of these survivors, whether it be their primary care doctor or their oncology doctors in their follow-up appointments, to recruit patients who are no longer being treated for active cancer, who were between the ages of 0 and 18 when they were first diagnosed and treated with cancer, and who have been done with cancer for at least 2 years. These participants also cannot have any chronic conditions at the time of this study. There is much significance with this research in regards to nursing. Nursing is all about caring for patients holistically, meaning that the mind, body, and spirit are all the focus of the care. Discovering how to improve one's quality of life, especially if their quality of life is being affected by health factors, is something nurses and nurse practitioners should be aiming to do. The findings of this study can help patients improve their physical and mental health. Care does not end with the completion of their cancer treatment. And in follow-ups with these children as they progress and grow, nursing and practitioners should be aware of what to look out for and how to help these children grow and be their happiest selves in their adult lives. This research provides new information about various topics. The surveys will provide new information about what part of these children's lives were impacted the most from their cancer treatment. It's pretty general, but it breaks up their quality of life into subgroups. And from the subgroups, we can assess and see if socially they're struggling the most, physically they are, mentally, so on and so forth. The interviews are a little bit more detailed, and they can provide information about what specifically these survivors would change about their lives to improve their quality of life. Information from this research can then guide further studies to close additional gaps in this area. So for instance, I spoke about there were gaps between, knowing how cancer treatment affects the quality of lives of men versus women. This can use that information and can kind of tell us men may feel as though their physical health is affecting them more so, rather than women who might feel as though their social aspect is affecting their quality of life more. And then studies can be formed from there. There are so many reasons to fund this project. This can just affect so many lives of so many kids. They have already been through so much, beating cancer and going through all this treatment for years and suffering through, cancer treatment is not an easy thing. These kids really deserve a chance to live a happy and healthy life. With this project, we can develop better treatment than we already have. It may be effective, but if there's a lot of side effects, we can aim to reduce those side effects to make the treatment that much better. And it can just help these kids become successful in the future. The youth is our future, and I think it's very important to do everything that we possibly can to allow them to live out the rest of their lives happily and healthily. These are just some references. They were all very helpful, And that is all.